All right, I'm entering the room. May I come in?
Yes.
I'm going to wash my hands. My name's Christina. I'll be your nurse practitioner today. Can you tell me your name and date of birth?
Michael Nehans, 9886.
Perfect. Can you tell me today's date?
April 12th, 2025.
Great. Who is our current president?
Trump,
And our current year?
2025.
Wonderful. Patient is alert and oriented times 4. What brings you in today?
Yearly physical.
Wonderful. Are you having any pain?
No.
Great. Doing an general survey. I don't see any signs of distress. Patient's well groomed, posture looks good, speech is nice and clear. I don't see anything concerning at this point. Face is nice and symmetric. Moving on, I'm going to do a generalized skin assessment. Patient would ideally be in a gown, and maintaining modesty, I would be looking over all of patient's skin. Starting with color. Color is appropriate to patient's skin ethnicity. It's nice and pink. It's warm, soft, dry to touch. I don't see any generalized edema. I don't see any lesions, wounds, ecchymosis, bruising, dysplastic nevi. I would be using my ABCDEs to assess anything on the skin and refer to dermatology as appropriate. Next, I'm going to just check your skin texture and for turgor. So I'm going to do something called a tenting test here. And while I'm on your hands, I'm going to take a look at your hands. I don't see any clubbing present. Checking for capillary refill here. Great. All fingers are less than 3 seconds there. We would be doing the same thing on the toes. Checking for capillary refill, all less than 3 seconds. Perfect. Next, we're going to go ahead and check your pulses. I'll be starting with your brachial pulses here. So they're nice and equal, bilateral +2. Radial pulses, nice and equal, bilaterally +2. Posterior tibial pulses on the tops of the feet here by the great toe, equally bilateral +2. Behind the ankle for the posterior tibial, equally bilateral +2. Great. Moving on to the head, I see facial symmetry. I don't see any abnormalities. I'm going to start by looking at the cranium. Cranium shape is good. I don't see any edema. I don't feel any edema. I don't feel any masses, nodules. I don't see any lesions or abnormalities in the scalp. Hair is nice and equally distributed. Moving down to the face, I'm going to go ahead and palpate your frontal sinuses here. Any pain or tenderness?
No.
How about here on the maxillary sinuses? Any pain or tenderness?
No.
Great. Moving on to the joint here, I'm going to have you open and close for me. Any pain or tenderness?
No.
I don't hear any pain, or I don't hear any clicking or popping. Patient is negative for TMJ. And then moving on, I'm going to do a nice sensation test on you. This is to check cranial nerve number 5 for sensation. You're going to tell me if you feel sharp or dull.
Dull, 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 dull. Sharp, 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 sharp.
Okay, there we go. Cranial nerve 5 is intact. I'm going to have you make some faces for me. So raise your eyebrows up, close your eyes really tight, very good, and a big smile. Great. So that is addressing cranial nerve 7. Next, we're going to go ahead and move on to your eyes. So looking at your eyes externally, I don't see any abnormalities on the lids. I don't see any edema around the eye. Hair is nice and equally distributed on the eyelashes. I'm going to have you look up to the ceiling for me. Looking at your conjunctiva, they're nice and pink bilaterally. Sclera is nice and white. I don't see any drainage. I'm going to go ahead and start by doing a little visual acuity test on you. This is to check for cranial nerve 2. And I'm going to have you cover one eye, and me stepping back 14 inches away, you're going to read the lowest line possible.
OLCF.
Great. And then do the same thing on the other eye.
OLCF.
Wonderful. 20/20 vision. From there, we're going to go ahead and do the 6 cardinal gazes. So without moving your head, you're going to follow my finger. Perfect. And that is addressing cranial nerves 3, 4, and 6. Perfect. Next, we're going to check pupils for accommodation. So I'm going to have you look at the tip of my nose. Beautiful, nice, brisk, normal, reactive. Nice, brisk, normal, reactive on both sides. Next, we're going to check behind your eye using my light. I'm going to be shining this light. You can look across my shoulder again towards me, and I'm going to look inside your eye. Keep looking straight. I see that red light reflex coming in. Optic disc is yellowy orange. Margins are nice and sharp and tight. I see the macula is present. Retina looks good. I see no abnormalities with the blood vessels. Perfect. On this other side, wonderful. The red reflex is coming in now. Nice and bright orangey red optic disc. Margins are nice and sharp. Perfect. I see the macula is present within the retina and no abnormalities on the vessels on this side either. Great. So that addresses the eyes. Next, we're going to move on to your nose. So for your nose, we're going to start with a nose patency test. I'm going to have you close one nostril, breathe in and out, and then while you're doing that, I'm going to have you do the same thing on the other side. Perfect. So that is just checking for patency, and that is addressing the olfactory cranial nerve 1. Great. So looking at the exterior of the nose, I don't see any abnormalities. Looking inside the nose, nice and cherry pink, little red. I see some scant drainage present. Canal's nice and clear. Moist turbinates. No drainage on this side. Canal's nice and clear. Moist turbinates. Nice cherry red color. Great. From there, we're going to move down to the mouth. So for the mouth, I'm going to be checking your gag reflex at one point. So looking at the outside of your lips, I don't see any cyanosis present. Go ahead and open your mouth for me. Looking at the teeth are all present. I don't see any cracks or chipping. Tongue looks nice and good. Buccal mucosa, nice and moist. Pharynx is nice and pink red. And then I'm going to check under your tongue for any sores, lesions, abnormalities. Great, I don't see anything. Go ahead and open and say ah. And stick your tongue out a little bit and say ah again. Perfect. Uvula is nice at midline. Tonsils are both grade 1. Tonsils are both present. Now we're going to go ahead and check that gag. Great. Gag is present. I'm going to have you stick your tongue out for me. And then wiggle it side to side, up and down. Perfect. So that is addressing cranial nerves 9, 10, and 12. So that was the mouth exam. Moving on to the ears. We're going to go ahead and check the ears. Externally, I see pinna and tragus present. I don't see any drainage, edema. I'm going to go ahead and palpate the mastoid here. Any pain or tenderness? Great. And then looking inside the ear, I'm going to pull down and back. Here on the left side, I see a nice clear canal. My cone light is pointed at 7 o'clock. I see some wax present on this side, pearly gray tympanic membrane. Perfect. Nice. Same thing on this side. External ear looks good. I don't see any abnormalities, pinna tragus. And then I'm going to go ahead and palpate the mastoid here. Any pain or tenderness? Perfect. Pulling down and back. I'm going to check this ear. On this side, there's no wax present. Canal is nice and clear. And there is the tympanic membrane. Nice and pearly gray on this side too. Perfect. That all looks good. We're going to now go ahead and do a little hearing test on you to address cranial nerve 8 for hearing. So I'm going to be 2 feet behind you, and you're going to start by covering your right ear, and then I'll be behind you, and you're going to repeat what I whisper.
Okay. 44.
Just waving my hand to show I'm present. And we're going to imagine that I'm 2 feet away. Go ahead and cover the other ear.
39.
Perfect. Cranial nerve 8 is working properly. Hearing has been assessed. Next, looking at your neck. I see the trachea is nice and midline. Before we go ahead and auscultate for bruits, I'm just going to have you shrug your shoulders up and down for me. And that is addressing cranial nerve 11. That's the accessory nerve. And then I'm going to do a little strength test on you. Perfect. Next, I'm going to auscultate for bruits before I do any palpation. Great. No bruits present. I'm going to check the carotid artery. Perfect. +2 on both sides. So from here, I'm going to go ahead and I'm going to be touching your neck a little bit to feel your thyroid, okay? So from here, I am feeling for the thyroid cartilage first as my landmark. Moving down, go ahead and swallow for me. Perfect. Thyroid is nice and smooth and soft to touch. I don't feel any goiter. I don't feel any edema or masses. Perfect. From there, I'm going to go ahead and palpate your lymph nodes, starting with the occipital here. Tell me if you have any tenderness anywhere, okay?
Okay.
Great. And then moving into the post-auricular, pre-auricular, going down to the submandibular, into the submental. Great. Moving on to the posterior cervical. Don't feel anything. Good. Any tenderness?
No.
And then anterior cervical. Great. And then into the supraclavicular here. Great. I don't feel anything. Actually, while I'm back here, I'm going to assess your back. Your back looks good. I don't see any like abnormalities on your skin, no edema, no lesions, wounds. I'm going to go ahead and listen to your lungs. So nice and deep breath for me. Great. All 8 areas were assessed. Now I'm going to do this with you saying 99.
99. 99. 99. 99. 99. 99. 99. 99.
Great. I don't hear anything unusual. It was nice and muffled like it should be. I'm going to do a check now for something called tactile fremitus. So I'm going to be pressing and you're going to say 99, okay?
99. 99. 99. 99. 99. 99.
Perfect. Next, we're going to go ahead and do something called percussion on you. I'm going to be just checking to make sure everything sounds okay. Any pain or tenderness while I'm doing this?
No.
Nice and resonant. Perfect. Lastly, I'm going to be checking for CVA tenderness on the back here using my 12th intercostal where it meets the spinal angle here. I'm going to do 1 tap and you're going to tell me if you feel any pain or tenderness, okay?
Nope.
And then same thing on this side using my 12th intercostal as my guide, meaning that joint where it meets the spine. Any pain or tenderness?
Nope.
Good. Looking at the front now, just going to go ahead and start with your lung sounds. Nice deep breath. One more time on this side. Perfect. Nice and clear. The back was nice and clear too as I was listening. So both are clear, anterior and posterior. Nothing to worry about there. With respiratory, everything was within normal limits. I'm going to check for tactile fremitus on this side. So I'm going to have you say 99 as I'm pressing.
99. 99. 99. 99. 99. 99.
Great. And then I'm going to just do a little palpation here. I don't feel any masses, edema, any tenderness as I was pressing? Good. Next, we're going to go ahead and listen to your heart sounds. So from here, I'm going to start with my aortic at the second intercostal on the right sternal border using my diaphragm. Next, I'm going to move on to the pulmonic, still remaining on that second intercostal to the left of the sternal border using my diaphragm, moving down to the third, to the Erb's point, using my diaphragm and my bell. Down to the fourth, I'm going to listen to my tricuspid, using my diaphragm and bell. And then going to the fifth, mid-clavicular, I'm going to listen to the mitral, using my diaphragm and my bell. Perfect, great. And then I'm going to palpate for the PMI. I'm going to remain in that between the fifth and sixth intercostal, mid-clavicular area. Using my fingertip, I'm going to palpate for that area of max point. Great, S1 and S2 are present. I don't hear any murmurs. Using my bell. Perfect, I don't hear any abnormalities. Wonderful. So that was the front on the chest. Next, we're going to have you slowly lay down for me, okay? And then we're going to pretend that my patient's at a 30 to 45 degree angle, and I'm going to have you look to your left for me, and I'm going to assess for jugular vein distension. So using my centimeters to measure, I'm looking for any kind of abnormality, raised vein. I don't see that. It's nice and flat. Don't see any edema present, using that point of max pulsation. Perfect, we're right at 4 centimeters. Great. And then you can go ahead and bring your face back for me. So now we're going to go ahead and take a look at your abdomen. I don't see any ecchymosis, lesions, abnormalities, nothing of concern. Abdomen's nice and flat. I'm going to go ahead, before I do any kind of palpation, listen for bruits. So I'm going to listen to the aortic first, and then my renal. Great. While I'm auscultating, I'm going to auscultate each quadrant for bowel sounds. Nice and normal active. I hear gurgling. Great. Nice and normal active. Perfect. Wonderful. Now it is safe to palpate. So I'm going to go ahead and do a nice palpation here. Perfect. And then I'm going to do a deeper palpation, okay? Any pain or tenderness?
Nope.
Good. I don't feel any masses, any abnormalities on either palpation. Great. I'm going to next check for your organs, and I'm going to palpate each organ. So here on the right side is your liver. Excuse my reach. I'm going to go underneath here, and I'm going to palpate for the liver. Don't feel anything. While I'm up here, I'm going to try for the right kidney. Good. Don't feel anything. Left kidney. And then I'm going to attempt to palpate for your spleen. Any pain or tenderness?
Nope.
Great. And I don't feel any abnormalities, no masses, anything unusual. Lastly, I'm going to percuss in each quadrant 2 times just to listen. Okay. Great. Nice tympany there. It was a little more dull over the spleen and intestines. That's to be expected. and then observing general overview, everything looks good. So I'm gonna have you slowly sit back up for me. Perfect. From this point, we're going to check sensation. So I'm gonna have you close your eyes and you're gonna tell me if you feel dull or sharp.
Dull. Sharp. 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 Sharp.
Very good.
Sharp. 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 Dull. 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 Dull.
Perfect. Sensation is all intact. We're going to check for your reflexes. So I'm going to start with the brachial reflex right here. And then the tricep. Perfect. Brachial on this side. Bend a little bit more. Right there. Tricep. And then brachioradial, brachioradial, patellar, nice little response there, and then patellar on this side. Okay, great. From there, we're going to assess for range of motion. So I'm going to have you lift your arms up and out, and then a little adduction, abduction, and we're going to do rotation, so internal and external rotation. Great. From there, we're going to address your elbows, so in like a bicep curl position, you're going to go in and out, back down, and then out, external, internal rotation. Good. Then we're going to do your wrists. You're going to go down and up, back down, out, and in. Good. So that addresses abduction, adduction, internal and external rotation. I'm going to assess for strength here on the upper extremity. So go ahead and hold your arms out for me. Try to resist my arms by pulling up. Same thing now by, good. And then we'll do your wrists, so this way. Try to push against, good. And then this way. And then squeeze my hands really tight for strength, good. And then bicep curl, try to push against, good. Other way, good. And then we're going to assess range of motion on your bottom leg. So go ahead and lift one knee up, extend your leg out, point your toes, point your toes back up, and then foot side to side, great. Can you do a circle each way? Perfect. We'll do the same thing with this side now. Point out, point toes out, back in, side to side, and then a little circular rotation. Good. So now I'm going to have you try to lift your leg against my resistance, assessing for strength here. Good. That all looks good. Next, we're going to, before I have you stand up, I apologize. I actually forgot a special assessment. It's called the Rovsing sign. I'll have you just quickly lay back down for me. I apologize. This is my special assessment of choice for the abdominal assessment. It's called the Rovsings. It's great for assessing when a patient is suspicious of appendicitis. So it's detecting referred pain. So I'll be palpating on the right. And ideally, if the test was positive, the patient would have referred pain on the left. Any pain, tenderness? Good. Nope. So come back this way and then sit. Great. And then my special test for musculoskeletal will be the Babinski sign. So I would be along the bottom of the foot and then rubbing along the bottom of the foot. And Michael's toes are curling inward. They're not fanning out. So that is normal sign for the adult Babinski test. Perfect. That all looks great. So I'm going to have you stand up for me. So feel okay? Mm-hmm. With your eyes closed and then arms side to side. Just stand there for a moment. Perfect. This is assessing for Romberg. I don't see any abnormalities in his balance, so you can go ahead and open your eyes now. And now facing the camera, I'm just going to assess your gait. So I'm going to have you walk towards the camera and then turn around and walk back. Perfect. And then you're going to turn once more towards the camera. And I'm going to take a look at your spine. So as I'm assessing Michael's spine, I don't see any abnormalities. Spine is nice and symmetrical to his body. I don't see any lateral curvation. And then go ahead and slightly bend forward for me. So as I'm palpating his spine back here, I don't see any lateral curvature. Everything is nice and symmetric and remains symmetric. Perfect. So then go ahead and have a seat for me. Perfect. So from here, we've done reflexes, special tests. We've assessed your musculoskeletal. We've assessed your abdomen, everything on the body. Any questions or concerns for me?